I would like to ask you permission to use this video for educational purpose and on internet.
Yes, I would do that.
Now,
It's
I'm
fine.
going to just turn around and show you have a very, very severe what we call scoliosis. Look at that. Your spine is side bending quite significantly. And as a matter of fact, it's side bending almost 30 degrees. When you're laying down, when you're standing up, it's even worse. And look at that. You have what we call grade 2 spondylolisthesis. Few years ago, they took the back of the bone off. We call that laminectomy. And our spine is like this. It's made of bone and disc. And sometimes when it's narrow in here where the nerves are passing, we take back of the bone off. But then we take those bone off and make a spine even weaker sometimes. And that happened to you. Your spine twisted and bended even more. Here you see how it's bending and it's sliding forward. Now,
Have you seen any this bad before?
yes, I'm a specialist that people like that come to me. So I have seen even things worse than that. But obviously that can cause a lot of pain. And your pain, they are telling me, it can be up to 10. Is that correct?
It keeps me at home.
Yeah. Now, you told me that that you went someplace, we don't want to mention the name, major university,
Yes.
and they told you they cannot help you. What did they tell you? Why can't they help you?
They looked at it and they said, oh my God, there's no way I would do that surgery. No way. You might come out crippled. You could possibly have worse pain. And she said, so I just won't do it.
Yeah, and you said even that you used the phrase, hey, that she said that she wouldn't touch you with a 10-foot pole.
That was another
Another-
surgeon at
another
another
nurse.
location.
Another location,
Yes,
that
and
they
he-
wouldn't even touch you with a 10-foot
No,
pole.
and then he wouldn't even explain to me, take time to explain my
Oh, I'm
situation.
sorry for that. I'm sorry for that. Now, to be honest, there are very few surgeons are trained to do your surgery minimally invasively. And doing your surgery open old-fashioned way, it is a big deal. It's very traumatic, and you may come out of it truly worse. That's why I think surgeons are good at weighing risk versus benefit. And if it's not benefit or don't outweigh the risk, maybe that they did do a favor not to do the surgery for you, because you would come out of that even worse. But for us, for me, for Inspired Spine, we do that surgery every week. Like last week I did the surgery on somebody, and just today morning I discharged the patient out of hospital.
The
So-
next day?
well, not next day necessarily in your age group, but many of our patients go home next day, and many of our patients go home within 2 days. Your situation is maybe a little more, requires more postoperative care, but this is a routine surgery for us.
Okay.
This is something that we do all the time, and patients come to us from entire United States to get this surgery done. And contrary to my colleagues, where the surgery is very, very risky, we reduce the risks, that it is reasonable to do this surgery for you.
Okay, so would you say then that the bottom ones that have really bad spondylolisthesis is what's
yeah.
causing most of my pain?
Yeah, I think it seems that the bottom four discs, where the spine is side bending and shifting, all of them, and I examined you, you have symptom corresponding to bottom four disc.
Would that correct that shifting?
That's a very good question. Now we have published a study about that. By us putting the spacers on this side, we can correct somewhere about 5 degree the side bending.
Right.
So by putting multiple spacers in, we can most of the time correct most of that side bending actually.
Well, it sounds like it's kind of positive that
Yes.
I
And
get
yeah,
out of some of this pain, because I
Absolutely.
don't like pain medication.
I know. We'll sometimes we don't have an option, but for you, we have an option. We have a reasonable option, and we have a track record of doing that. And as a matter of fact, if you go to YouTube, yours will be there now and after the surgery.
Really?
I have hundreds of patients in similar situation that after the surgery, they come and explain that how they did. And many of these patients, they are telling me they woke up, the leg pain was gone, but sometimes the back pain can take longer to go away. And, obviously no surgery comes free of risk, with any kind of guarantee. But we have a track record and we have published our result and we are proud of it. We have
Okay.
helped a lots of people.
I also have a knee that's going on bone.
Yeah.
I get ablations for that.
Yeah, well,
It
somebody
does help.
somebody can help you with that. But you said you have done your research on us
I
about
have,
us.
and it's
What did
wonderful.
what did you find out?
5 stars on you wherever I look.
Thank you. But have you listened to people on YouTube?
Good testimonies.
Yeah,
So that's what
this is your
convinced me that you
Yeah.
were the one. And I did go to a number of neurosurgeons throughout Minnesota. So I did my research and
but they couldn't help you.
no.
That's why you're coming to me. So
Not
you're in
at
the
all.
right place. You're in the right place. When the situation becomes too difficult for other surgeon, that is when patient come to me. So you're
Right.
in the right place. Well, this is a preoperative testimonial. I'm going to get testimonial along the way, see how you are doing, and we are going to stay realistic about it. Well, thank you for this testimonial, okay?
Thank you.
Thank you.